Welcome back to the White Paper channel. Today we're going to be covering the structure of the phase 2 study for Moderna's mRNA 4157 or the PCV. This is more of a correction to a previous video. There was a Redditor that reached out to me and said, hey, the structure that you're proposing is not correct. He sent me some of their slides, and so that's what we have here. So let's go ahead and get into it. So on this slide, you can see that it does say that, for one, it is a combination trial. So they are definitively getting both pembrolizumab or Keytruda and the mRNA 4157, and then the control arm is just getting Keytruda. Also, something interesting to note here is that it is a 2-to-1 study. So for every one person in the control arm, we will have 2 people in the treatment arm, which, we can look at the past melanoma studies for Keytruda. So that's not actually the most important part. All right, next slide. So, and I found this one to be very interesting, this is their trial of the combination against HPV or human papillomavirus for head and neck squamous cell carcinoma. That's what that HNSCC is. So head and neck squamous cell carcinoma, it conveys a terrible morbidity and mortality. And so as you can see here, if we start from 0, and the SD is kind of, where everybody's starting from, and they start from there and receive 2 doses of Keytruda before they ever get their first dose of personalized cancer vaccine. And so this really leans more towards what the Reddit user was trying to convey to me, that the structure of it, they should definitively be getting both drugs. Now, some of this data is pretty interesting. I think the first thing that really stands out to me is they had one person who withdrew from the study before they even received their first vaccine dose, which, like I said, head and neck cancer can be really bad. Maybe they had metastases to organ systems that precluded them, made them too sick to undergo, further therapy. And then we have this group right here. We have this patient number 81 who really had bad progression and then made a sharp downturn after he started receiving the vaccine dose, but then made another bump back and was withdrawn after C8. So not sure. It looks like the vast majority of people who actually received the vaccine dose are moving in the right direction. You want them to be moving down and to the right, the opposite of what you want your portfolio to be doing. But so yeah, I think seeing this kind of head-to-head comparison is going to be pretty interesting. So, when that data comes out, I'll give you guys another update. We do have the Piper Sandler presentation happening about 30 minutes before market open. So I'll give you guys an update on that later today.